I've been asked to talk about people and patient-powered care with a technology lens. Now, I'm no futurist and I'm no technologist, but I will be touching on some work that we've done with our clients around the world and non-clients, of course, as well. Last year, we got together 65 health leaders from 30 countries across 6 continents, and we had a very jolly time at the Langham Hotel in London. And what we did over 2 days is we had 7 provocations. We engineered arguments on the basis that Hegel and his dialectic was right. So we'd have a thesis, an antithesis, and then a synthesis. And we'd argue over 7 provocations. And I'm going to show you some of the slides from the research that we did leading up to this conference that shows you what these provocations are around people-powered care. This first one is all about the locus for change. So 72% of our global health leaders thought their existing business models in hospitals were sustainable, yet nearly all of them thought or expected moderate to major change. So what does that slide tell us? Basically, I'm okay, it's the system that smells of something which looks like brown. Our crowdsourcing community, people who work in the organisations, felt even more strongly about this. As you can see here, that what is the scale of change required in your organisation? Well, perhaps some saying fundamental, some saying moderate, but then when you say, what about your country? Oh my God, it's awful. Now remember, global leaders, 30 countries, 6 continents. We deliberately asked this question to try and elicit a negative response. So I'll slow down. Bringing primary and secondary care together into the same organisation does not create sufficient additional value to justify the difficulty of doing so, i.e. the climb is not worth the view. And they disagreed with this. So the future, these health system leaders were saying from around the world, is that basically integrated care between secondary and primary care is the way to go. Now, because I've been to Canada 19 times, I know that if you accept this as a conclusion, that your journey is simply enormous, because your hospitals are fortifications and your GPs are basically bobbing around as independent practitioners, although this province has done more than most others. Patients are a tremendous source of renewable energy for healthcare, and I'm going to show you why in a second. 72% of global leaders believed that empowered patients create better value care. I think that's a pretty honest answer. And then further, once again, our global group, that 89% of leaders, this is our dirty little secret, of course, that 89% of leaders believe their health systems are designed around their organisations, not their patients' priorities, and they're not very satisfied with meeting their needs. It tells us something we all know, that I think the public or patients might be slightly alarmed to hear, that we run our organisations for their own sakes, not for patients' benefits. Now, 79%, 80% of our crowdsourcing community believe patient experience indicators are being more widely used. Only 14% of global leaders thought their patients were becoming active. Once again, a long way to go. That's okay. We know it's going to be difficult. So these were the 5 conclusions from our global research. And I think it represented over 20 million patients in the patients groups that we worked with. See me and support me as a person, not a condition or an intervention site. Patients want to be informed partners in care. I like this one, having been through it myself. Fragmented care is harmful and wasted care. Patients can feel abandoned at discharge, but very, I think, anxious on discharge because of the lack of integration and care continuity. Patients want to be empowered partners in care, and then in some countries, of course, just getting access to care is quite difficult, including Canada. Now, why is that important? Because if we know that, and it's all quite obvious, are we doing enough to orientate our health systems to make it better? I don't propose to go through in the last 26 minutes the theory of patient activation, but the higher the level of activation or empowerment, the less consumption of care. And I think as a human being, this is really life reaffirming. It tells us that most people, in fact, don't want to be ill. And in fact, most people want to get on with their lives without seeing a doctor and nurse and bumping into a health clinic or a hospital. It's as simple as that. But these levels of activation, from 1 to the lowest, 4 to the highest, patients with low activation scores cost 8 to 21% less. Which country in the world doesn't want that? So this slide, I think, is the most interesting slide and the most simple slide for you to remember today. It basically says, what does the average citizen consume in hours with clinical professionals? And the answer, as you can see, is 10 hours. And then the waking average citizen spends 5,840 hours managing their own conditions. Why is it? Would anybody care to guess why this slide is a great slide? It's not in my book, by the way. I wish it was. Because all of our efforts as a health industry are directed to the 10 hours, not the 5,840. What a strange old industry we are. So the future, my friends, of course we can make that 10 hours more effective and efficient. Of course we can bear down on costs. Certainly if you're spending 11.1% of your GDP, that's certainly possible. But actually, the clue to sustainability is 5,840. And that's where technology is such an important part of our future. Why? Because technology never sleeps. I was asked 2 weeks ago by the Washington Post and the Wall Street Journal how many years, and then they paused and said months, would we be from the Uberization of healthcare. So in India, I think we are literally months away for, say, $1 a time, where 84% mobile penetration in India, that people just use their phone. Their care provider is their telephone company. They pay $1 a month or $10 a month. They get access to a triage system with a doctor and a nurse. That triage system gives them advice on the phone, and then they go to a retail pharmacy to get their health care. They skip out primary care and hospitals. And these, of course, only in the USA. All of these companies now are trying to think about a new business model. And much more clever people than I will soon imagine what all these big players do. America. This slide's from The Economist. The rise of retail pharmacy. Low cost, standardized healthcare in your supermarket. Look at that exponential growth in the US. And that's partly because people want cheaper healthcare, and obviously because they want more convenient healthcare as well. Now, whatever happens in terms of the disruption that may or may not come between primary care, the LINs, the CCACs, and public health over the next few months, integration of information will be obviously of vital importance.